Hi, my name is Tia Baker, and today I'm going to do my cardiovascular and pulmonary exam. So first thing I would do is hand hygiene, and while I'm doing my hand hygiene I would inspect my patient, and I would check for symmetry of his shoulders, and I would also have him shrug, check for his muscle strength. I would also look at his thoracic cage and make sure that it was symmetrical on both sides, no abnormal lumps or anything like that. Then I'm going to palpate for tenderness or masses. Do you have any tenderness or masses?
No.
No tenderness, I didn't feel any masses. So then I'm going to check for symmetrical expansion. So I'm going to have you take a deep breath and out. Alright, and it was his lungs filled and exhaled, and it was symmetrical. Then I'm going to have him say, I'm going to check for tactile firmitus, and I'm going to have him say 99. So every time my hand hits you, say 99.
99, 99, 99, 99, 99, 99.
Okay. And I felt a slight vibration, and that's what you should feel. I'm also going to get my stethoscope, and I'm going to listen to his breath sounds. I'm going to listen, take a deep breath. And his breath sounds were clear and equal bilaterally. Then I am going to do the whispered pectorology. I can't say that word, but pectorology. Anyway, I'm gonna use my stethoscope again, and I'm gonna have him whisper 1, 2, 3, and I shouldn't be able to hear anything at all. And if I do hear something, that means there's a mass in his lung, because sound travels through a solid, and it doesn't travel through air. Alright, so whisper 1, 2, 3. Okay, and I did not hear anything. Next, we're going to have him say E every time I place my stethoscope, and it should sound like A.
E. 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 E.
Okay, good. And next I'm going to have him say 99, and it should sound like a drum. It should not be clear. You should not be able to just hear him say it.
99, 99, 99, 99, 99, 99.
Okay. Alright, so then I'm going to have him turn around. Alright, and once again I'm going to look for, to make sure he's symmetrical on both sides of his shoulders. And I'm going to palpate, and do you tender anywhere?
No.
Okay, I didn't feel any masses. So then we're going to move on to the symmetrical expansion. Okay. Alright, breathe in. Alright, and my thumbs moved apart, so his lungs are expanding symmetrically. Then I'm going to get my stethoscope again, and I'm going to listen to his breath sounds. Okay, and they were clear and equal bilaterally. And then once again, we're going to do the whisper test. So I'm going to have him whisper 1, 2, 3 when my stethoscope touches his back, and I should not be able to hear anything. Okay, and I did not hear anything. So then we're going to do the, have him say E, and it should sound like A. Alright. Then I'm going to have him say 99, and it should be dull, it should not be clear.
99, 99, 99, 99, 99, 99, 99, 99.
Okay. Then I'm going to place my hand and have him say 99.
99, 99, 99, 99, 99, 99, 99.
Okay. And then I'm going to percuss. I'm going to take my finger and hit it and check where his lungs are. Okay, I'm going to take it in a big deep breath and hold it. Okay. Alright, and then I'm going to move on, and I am going to listen to his heart, so I'm going to turn my around. Alright, and we're going to listen to his aortic, his pulmonic, his tricuspid, and his mitral valve. So, let's see. And the aortic's going to be on the right side in the second intercostal space. And then his pulmonic's going to be on the left side in the second intercostal space. And then we're going to come down to the fifth intercostal space. That's his tricuspid. And then we're going to come over and to the fifth intercostal space and listen to his mitral valve. Mid-clavicular. Okay, and then I'm going to listen to a full minute and check for rhythm and rate. Okay, and with the clock over there, his rhythm is about 75 and his rate is a normal rate. Then I'm going to listen for his carotid pulse, and I am going to listen for any bruits, and I'm going to listen with my bell and my diaphragm, and then I'm going to listen with my bell to his heart sounds as well. Alright. Okay, I didn't hear any bruits, and I'm going to listen to his aortic, his pulmonic, his tricuspid, and his mitral valve with the bell. Alright. Then I am going to palpate his carotid pulse, and I'm going to be palpating and making sure there's no thrill. And also I'm not going to palpate both sides at the same time because you could cut off circulation to the brain. Okay. His pulse is strong and even on both sides, and I did not feel a thrill. So that's good. And with that, I think we are finished. Thanks.